Meeting on February 26th. The first thing we're gonna do. Good morning.
Morning.
Good morning, everyone. We're calling the meeting to order. Am I not loud enough?
Calling the meeting to order.
Moving voice, that's what I need. Yes, we call the meeting to order. And the first thing on the agenda this morning is we're going into executive session to discuss legal counsel matters relating to the agency enforcement actions or potential litigation according to RCW 423011-1XI. We're up to 30 minutes, so excuse us. right, good morning, welcome back. Thank you for allowing us to convene. Next on the agenda is a time of introduction. We have no staff introductions today.
Nope.
No. Then we'll move into public comment. Claudia, who is going to introduce you.
Hello, good morning, Claudia Cepeda, and I am accompanied by the group of Latinx outreach representing, well, we're not representing the people that in our community because there are too many and we are so few, but we are part of the community and then we're here as part of the community, Latino community. Thank you.
One other.
Yes.
Hi, I'm Evan Pierce, and I'm interning under Kyle Curtis here at the Yakima County Commissioner's Office.
Wonderful.
I'm from Heritage University.
Okay, so this is a public comment time. If you'd like a little time to make a comment, this is the time to do it. Otherwise, we'll move forward.
I'm good.
Claudia?
Sí, no me pregunta qué es lo que ellos tienen preparado.
Hi, everybody. My name is Gabriela and I'm with Latinx. And one of the comments or the questions that I have, I'm here representing my community. It's about the programs, the mental health, the mental education. Our community is in need. And that's why we're here and we want to know like how you guys can support us. Our community are having, probably a lot of you guys know that we're having a lot of issues with kids are using drugs, suicides. I have a family member close to us are having a situation like this. And I feel like it's time for us to stand up for those that are not here today and ask for help and see how you guys can help. How can we get all together? I've been with Latinx for a while. Programs that have been helping me a lot, my kids, my family. I have a 13 years old now, and he's been through these programs, a lot of help. And that's what I'm looking for community. Thank you.
Thank you, Gabriela. And I will say that during public comment, we don't really engage in conversation, but we have Edie Dibble here today, who is
Yes.
yeah, thank you. That's who works with comprehensive mental health. And I would suggest that after the meeting, that you can connect with Edie and we'll get some helpful information.
Your buyers, although we don't typically engage everyone, I did want to ask a question of the group, if you wouldn't mind. I'm just curious, now, do all of you speak English? Or not?
Not all of us.
Entonces lo voy a hacer en español. ¿Cuántos de ustedes escuchan a la Radio Cadena? Okay.
How many people listen to radio?
Yeah, that was how many people listen to Radio Cadena. That's, okay, thank you, gracias, thank you. Just curious.
Any further comments? Thank you very much for joining us today. We appreciate it. And we're going to move forward in the agenda. Next is a review of, I'm sorry, the consent agenda. Do we have any written comments, Mr. Ivan?
No.
Okay, no written comments. The items of this agenda are approved with a motion together. All the ones with an asterisk are considered routine by the health board and will be enacted by one motion. There will be no separate discussion of these items unless a board member requests, in which event the item will be removed from the consent agenda and considered in its normal sequence on the agenda. Does any board member wish to remove an item from the consent agenda? Hearing none, Mr. Arbach, would you read it, please?
January 29, 2025, Yakima Health District Board of Health meeting minutes. Payment of accounts payable and payroll issued in January 2025 in the amount of $1,171,400.74.
Thank you. I would entertain a motion to approve the consent.
Motion to approve.
Thank you. Thank you. So we have a motion and a second to approve the consent agenda as read. All of those in favor, please say aye.
Aye.
Anything else? All right, motion passes. Thank you very much. Next on the agenda is the Health District Spotlight. This month is on advancing food safety, a culture of prevention, and John McGee is presenting.
All right, good morning, everybody, and thank you. So yes, today we'll be, do I hit down or not? Yeah, perfect. Today we'll be looking at advancing in our retail food safety program and how we foster a culture of prevention in our community and retail food industry. There we go. All right, so we're looking at a graph here of the 51 total outbreaks that occurred in Washington State back in 2022. As you can see, roughly 2/3 of them were happening in restaurants. So that's 2/3 of foodborne illness outbreaks that are occurring in facilities that we have direct oversight of, that we permit, we inspect, we work with to maintain food safety. So what this tells us is that we can have a very large impact in preventing foodborne illness outbreaks in our community. In addition to that, we also have seen data that suggests that nearly half of all of these outbreaks are caused by ill food workers. So food workers are coming in to work ill and passing this illness along to others. A problem we see in the food industry a lot of times is that these people rely on a lot of hours, and they work a lot of hours, working in the food industry, very fast paced and busy environment. So not a lot of wiggle room to be short staffed or to miss work for a lot of folks that are in this industry. So the expectation is you come to work. There are regulations that talk about not allowing sick food workers to come into work. However, sometimes that is outweighed by the need for people to be here. So it is our job to not only regulate that, but also to educate our facilities on the importance of keeping ill food workers out of a food prep area and coming to work, because it very much can lead to an outbreak. It's the most common cause of foodborne outbreaks.
What I hear you saying is that it's a combination of decision by both the employer and the employees who have a desire and need to be at work.
Yes, and we try to communicate with restaurant ownership, operators, and employees that if you're sick, don't come to work. If your employee is sick, don't let them come to work. Support that they need to stay home and they need to recover before they come back to work.
So, and if I may, we also, in terms of education, share the fact that it may feel pressured if you are short-staffed, but it's much better than having your staff become ill and having the patrons who really love your establishment. And we know that restaurant owners want to make sure that the people that they serve are cared for.
Absolutely. So in addition to ill food workers, there are still a whole host of other contamination factors that we do witness, and we see potential for foodborne illness outbreaks. A big one is bare hand contact, or improper use of gloves, improper hand washing. So we see people that might be prepping a steak for to be cooked, and then they move over and they start prepping a salad. You know, there's a whole series of events that need to take place before that person will go and touch the lettuce after handling raw meat. Remove gloves, wash hands, put on new gloves, that sort of thing. And we see cross-contamination from different foods that are stored improperly. For another example, chicken has a higher cook temperature requirement than steak or whole beef. And if chicken's stored above that beef, you get chicken juice on the beef, and you have cross-contamination potential to not reach the appropriate kill step for any contaminants that might be on that food. We also do see that there are contaminated food or expired foods or foods that have been held out of temp upon delivery. That's not necessarily the food establishment's fault, but we want to teach them how to recognize those things and what the appropriate steps are if they receive food that is not the condition it should be. It's a major inconvenience to have to not accept that delivery and send it back, but it is the right thing to do, and we want to help them make that decision. Again, people coming in, if you're a popular restaurant and you have several hundred customers throughout the day, chances are you may have somebody who's not feeling 100% come into your establishment. So working with establishment to establish barriers to prevent contamination from patrons or customers that protect the rest of the people visiting the establishment. You know, buffets are a big one. Having sneeze guards, you know, hand sanitizer, those kinds of things available for customers to use is important, and clean plates and silverware so people aren't reusing the same dishes over and over again. A big one that we discuss with our food establishments is the cost of a foodborne illness outbreak. There is a cost associated with it. A lot of times this can lead to a temporary closure. Most of the time, the establishments will voluntarily close, but sometimes we have to ask them to close their doors for a while while we perform our inspection of the facility and, you know, interview employees and things. That's lost revenue. The resources from public health, it costs staff time, and you know, it costs the health district money, it costs the restaurant money, depending on the severity of the outbreak. A lot of times it leads to food that has to be thrown away. That's food they would be making money on. The costs for lab testing, potential legal fees and lawsuits. If somebody's it causes long-term or permanent harm to the person, then a lot of times we see legal action taken. And it can affect their insurance premiums. And a lot of restaurants will make large efforts to restore their reputation following an outbreak. So, you know, marketing themselves, advertising on social media, the newspaper, the news, or ads. It all costs money to try to recover from these things. So it's much cheaper to prevent this from happening than it is to recover from it. So,
John, I'm sorry, just kind of reflecting on that a little bit. The statistics for the state of Washington were pretty significant, I think. How does that compare to statistics in our valley?
Believe in 2023, we had 2 foodborne illness outbreaks that we needed to respond to. Last year, we had 0. And we're hoping for a 0 again this year. Yes.
Sean, when we say outbreak, like how many people does that affect? Is it?
It's 2 or more with a common link. You know, in our investigations, we get a report of somebody, you know, they think they got sick from eating at a certain place, and we gather a food history on that person from the previous 3 days. You know, if there is a number of facilities that are mentioned, then we ask if anybody else in your family or your group is having the same symptoms. Did you go to eat at the same place? You eat the same things, to try to confirm something. Or if we get a confirmed case from laboratory testing through our CD division, we follow that process with trying to contact other people in the party, go do an environmental assessment of the restaurant itself, and start interviewing workers.
Sean, I'm assuming there's probably a large percentage that don't report when they.
Oh, absolutely, yeah. Yeah, there's a large percentage that you don't think you get a tummy bug and it'll pass in a couple days, which it usually does, but not everybody calls in, or not everybody goes and sees a medical provider if they get foodborne illness. So over the last few years, FDA has come out with the Smarter Food Safety core elements, and this is kind of breaking down from manufacturing to distribution to down to the local level of food being served in food establishments, and then what local health jurisdictions can do to promote food safety culture in their area. Having tech-enabled traceability, so food that's being distributed could be tracked through an electronic system if there's an issue during that process. State and local agencies can be notified. There's smart tools for outbreak prevention and education, you know, breaking down specifically what causes outbreaks. You know, in years past, an inspection was kind of more of the white glove style. Is the facility built correctly? Is it clean? Is it operating smoothly? we're taking a deeper dive into what are the specific steps of specific processes for different, dishes that are being made. There's all kinds of different steps where there can be a contamination event occurring, which can lead to an outbreak. So we're looking at breaking those down, making sure that those are documented. There's a workflow. Employees know what that workflow is and that we're following. And then foodborne illness reporting systems. We have a statewide one called FINS. If there is a complaint that's logged somewhere, it goes through that system. It's directed to the appropriate local health jurisdiction, which we can respond.
Sean, do you see any more incidents in the truck-based food establishments versus the permanent-based food establishments?
Not very often. If there is an event, from a tractor trailer hauling food products, like the refrigeration unit goes out.
Oh, I don't mean that. I meant the food trucks, not the delivery trucks.
Oh.
Like the events, carnivals, et cetera.
And do we see what with that?
Do you see a higher incidence of foodborne illness events in that compared to permanent restaurants?
Foodborne illness outbreaks? No, I would say we've seen more brick and mortar facilities have foodborne illness outbreaks. I think it's mostly due because a lot of the food trucks, they can't cool foods on the truck and then reuse them. Usually it's they take what they need out with them for the day. They prep it, they cook it, they serve it. Not a lot's going back and being stored overnight. It's typically not part of their operations plan. But in restaurants, they have soups or different pastas, whatever. They cook it, they hot hold it, they serve it, then they cool it down and store it overnight and serve it again the next day. If that's not done properly, that can easily trigger a foodborne illness outbreak. So there's a lot more steps in a brick and mortar that are allowed to happen if done right versus a mobile food unit.
In the time that I've been here, I've seen two larger outbreaks. One of them was the Chipotle one that we had, and it was more where you had cross-contamination. You had an ill worker who was touching, the lettuce and the salsa, and there was a lot of cross-contamination going on. And then also one was a catered wedding. So it wasn't necessarily the vendor, but all the people that were there that were contaminating all of the food there. That may not have been supplied by the vendor.
Well, and it's not official data, but my son's been to all the food trucks. And he's never gotten sick. He's hauled me around to some and I'm like, son, this looks a little sketch. And he's like, I've never gotten sick. And I'm like,
And the ones that you see, the traveling ones, they're actually inspected very regularly.
Yes.
Much more than a brick and mortar.
Yeah, and that's a good point. Our mobile units not only get routine inspection done for their normal operation, but they typically get inspected when they go operate at a special event every time they're at an event. So some of them could get half a dozen inspections a year. And, that's, good for them and good for us, make sure they're safe. And
I'm rather surprised that from catered events that there isn't more, because once it's out and served at buffet style and there's no sneeze guard, there's nothing. Everybody's going through fingering the food. It's amazing. Then
We'll need to thank Alicia's son for his research.
yeah,
so some of the priorities for, that lie within FDA's smarter food safety core elements, but that we've really brought it here that we're focusing on is, building a shared attitude and behavior by our food establishments that prioritize proactive food safety, that they're really engaged in and taking pride in that their food is being safe, it's being prepped right, it's being cooked right, being stored right, and we're trying to get to the point or building a relationship with all of our restaurants and food trucks and the like that, they're not upset when we show up. They're like, yeah, come take a look. I'm doing everything how you need it to be done. So that's really our big push and working in partnership with our food industry here in Yakima County. So again, looking into our role in building a food safety culture is, again, moving from that enforcement style white glove inspection and shifting towards more of a collaboration with our food establishments. We still have to do the inspection. We still have to write the reports. We still have to document issues when they come up. But we're really focusing on education and working with our establishments. We don't want to go in and say, you're doing this wrong. We go in and say, you're doing this wrong. Here's why, here's how. This is how you can do it right. So we're engaging with them and showing them what the correct process is and giving them documentation that they can follow and work on these things and improve upon them. So there's long-term success versus them just doing what we say in the moment, fixing it, and then going right back to their old behavior after we walk out the door. So we want to provide accessible education. We want to partner with them and build towards success and food safety and make sure that there's always open communication between our establishments. Our inspectors get a list of restaurants that they're going to go out and inspect. They leave their contact information. If any of these facilities have questions, all they got to do is pick up the phone and call, and we're happy to work through any issue that they're having with them at any time. So another thing, with the revision of the Washington Administrative Code that sets the minimum requirements for retail food safety in our state. The requirement for certified food protection manager came into play with that revision. So pretty much all of our food establishments are required to have one person on staff that has this certification. It's a long course, it's a difficult test, and it's expensive to take through third-party services. So what we did is we purchased the exams and the course, and we now offer that here at the Health District. We're looking at probably a quarterly basis this year. This year is the first year we've adopted the new fee that was approved at $40 a person. Our goal is to have 20-person class sizes and teach that in a group session quarterly. And that information is given to operators when we find that they're lacking that certificate when we do their inspections. So it's been really successful. We've had dozens of folks come through and take that, and we're above the state average on pass rate for that. So $40 a person is a lot more acceptable to restaurant operators than going through a private third party paying $100 to $180. So we thought, if we're going to require this is going to be a requirement by law. We want to put into practice what we've been shifting towards and be collaborative with our facilities, support them, and be a resource to them. So we're able to do that through
Nice
these group setting for getting this. I didn't talk. So yeah, 75+% pass rate. So we're above the national average. And this is also, again, it's helping to strengthen the relationship between our facilities and the health district. They're not looking at us as, just coming in there and punishing them for not having this required certificate. For giving them an avenue to be successful.
If
And
they
yes,
fail,
English
are
and
they able to-
Spanish.
If they fail, are they able to retake the test or?
Yes.
2 attempts, the final exam.
And if I may, it's a pretty serious requirement where people have to actually stand up and show their surroundings to make certain that they don't have anyone helping them. It's pretty.
It's a proctored exam.
Proctored.
So that's why it's also easier to be done here.
Yeah. And this is a big one too. We have a lot of temporary food vendors in our community, especially during the spring, summer, and fall months. We have a lot of great events here, and which brings a lot of vendors with a lot of great food. And there are a lot of people that are attempting to kind of break into this market and start up, a part-time small business and serve food at these events. And we noticed that there's really not a lot of how to do this or demonstrations on how to be successful at this. This is the equipment you need. This is how you do it the right way. And, with that lack of resource and information available, and you combine that with them operating in a high-risk environment, not always plumbing available, so they They have to have certain types of containers that hold hot water, cold water, to be able to wash hand dishes. They have to prep food a certain way. They have to store food at proper temperature still, and those requirements are all there. And doing that without potentially electricity or running water can be very difficult. And we had over 800 of these applications last year, so we expect to have at least that many this year. So we really felt the need to push for some education and outreach to really help existing vendors and people who are thinking about starting up a business to be a temporary food vendor. And with that, we have a short video of our temporary food event workshop that we conducted last year. Enjoy. We just want to give a quick shout out and thank you to all the staff that worked on putting that event together. It was very successful. We had over 20 potential new vendors show up and kind of learn what it takes to be successful in that industry. And we had several existing vendors show up and kind of start to build those relationships with the health district. We don't we definitely don't want to be feared by that industry or think that we're the food police. We are in a sense, but we take that, we stress that we take that educational approach first. We want to.
Sean, if you wouldn't go in with your cop uniform, that would help.
The what?
Your cop uniform.
I'm not the one going out there typically.
I would just like to say that my husband probably rivals Alicia's son in his love for food trucks specifically. And 20 new vendors is something I'm going to share with him tonight. He's going to be very excited. And he's pushing for someone to come up with the mapping. When you go to some communities, you can pull up the maps. But it's out there. It would be.
Get some air tags on all of them.
Yes.
Might make it easier to track some down.
Yeah. It's going to be the highlight of his day when I tell him this.
How often is this workshop happening?
We did the one last year. I know we're trying to coordinate on what the next one could look like, but we do see a need for more. But no specific timeline on that yet. We're trying to time them up when our busy season starts, which is around April, heading into May.
So this could be annual, is what you're
It
saying.
could, yeah. Yeah, and typically we'll probably see it later in the spring. Also, food workers are required to have food handler cards to work in the food industry. So again, it's a need, it's a requirement. We want to be a resource for folks to achieve that. We have our walk-in computer lab. It's open Monday through Friday, 8:30 to 4:30. And people can come in and take that anytime they want. They can take it online with their at their own home on their own computer. If they don't have a printer, they can come in and have their card printed here. We're pretty accommodating and making sure that folks get that card in their hands once they pass that exam. So it's an ongoing service that we've always provided here and will continue to do so in the future.
But is there a renewal date on the cards? Do people have to repeat the class like every?
The initial card is either 2 or 3 years, and if they renew it before it expires, they get an additional year that it's valid. So, an incentive to renew it.
On here, the online option's not listed. Is there a reason?
Oh, the link's not on there?
Well, I see it on the website, but on here it's walk-in. Am I missing it? that there's an online option?
No, there definitely is.
Yeah, it's its own website.
Yeah.
It's the Serve Safe, Do It Right, Serve Safe website, I believe. But yeah, which is a separate site from us. We just have computers that access it and they can log in. We also do in-person trainings. So we've partnered with a lot of our area schools, the Yakima Nation, and any organization upon request can receive in-person classes for food handler cards. We typically want to have 20 attendees to go and teach the class, but the cost is still just cost of the card, $10 a person. And it includes, we do the video, but the course is more interactive. We have a short Q&A session after the video, make sure everybody feels comfortable going into the exam. They take a written test right there. We grade it for them. And if they don't pass it, they do get a voucher that they can go retake the test. And once they pass, they can get their card. So it's not a $10 you fail, you got to pay another $10. They get to try a few more times. And this is really helpful, and it's building partnerships within the community. It's helping folks get ready for employment. You know, there's a lot of high schoolers out there that want to have a part-time job, and that we can partner with schools to allow them to get food in their cards is really helpful for them. So. Yes. Oh, and this portion of our program, this is a pretty unique setup. If you're going from looking at a lot of the other LHJs across the state, we have a dedicated full-time person in our environmental health help desk. Actually, two. We have our public health specialist, and then we have an environmental health specialist that is always available to help with some of the more technical aspects of what people are coming in to do. Specifically for our food safety program, it allows one of our staff members to be available to help guide people through their application, let them know what documents that need to be submitted for their application to be complete, so that they can, you know, be successful through our plan review process and then be prepared for a pre-operational inspection when they actually are ready to open their doors and start operating. So we have people available to help them every step of the way. Again, they can come in and do that in person. We can do it over the phone, by email. We can accept their documents electronically through email. And hopefully someday through Acela electronically would be nice, but we're working on that. But again, our help desk is meant to be a service to the community and allow new business owners or even current business owners to get their questions answered and navigate the complexities of, you know, being a permitted restaurant in Washington State. Yeah, that's the services our help desk provides.
If somebody in a facility fails an exam, or not an exam, but the actual site visit, are they put on a queue to be re-examined in a shorter time frame?
Yeah, our inspections are in a way they're we could call them risk-based, but yeah, if they don't pass an inspection, they are due for another inspection within a certain amount of time. It kind of is based on, you know, how badly did they not pass the inspection versus what's their risk level. So our restaurants are broken down by hazard level 1, 2, and 3. 3 being the most complex, you know, big restaurants that have a lot of food processes. Level 1, a lot of our coffee stands, you know, they're just serving different varieties of coffee. So those things, along with their score of their inspection, will tell us when we need to come back and do another one. But if they outright fail an inspection, we're usually coming back for a follow-up. We're coming back for a follow-up within 2 weeks to make sure that those corrections have been made and the correct processes have been implemented. And if that still doesn't work, that's when we start to go down more the enforcement route of compliance inspections. So how do these tie into our strategic goals? Well, number one, our food safety program is a mandated service. We're mandated by the state to oversee our retail food safety in Yakima County. So that's how that ties in. We have to do it. Developing a network of community partners invested in improving public health, taking this education outreach approach and not as diving directly into the enforcement aspect to it as quickly as we once did. This is building a lot of trust with our facilities. The temporary food event workshop that we had, we were actually approached by a facility and asked us if we would be willing to come do such an event at their business because they saw a need in the community and they knew that, you know, we would welcome the challenge of coming and educating people and kind of organizing this event. So, you know, it's working and that we're building the trust with a lot of our restaurants. We get more and more calls all the time about, hey, can I do this? I'm not sure. That's not really clear in the regulations. If I can, you know, do sous vide or if I can smoke this meat when it's not in my operations plan, how do I go about doing that without getting in trouble? So, you know, we're seeing that network grow and build, and that's leading to more open communication between us and the restaurants that we regulate. And with that, when we have people that are buying into a culture of food safety and there's a level of trust that's being built with us, and we have more open lines of communication, it allows our program to operate a lot more smoothly. Our staff don't have to spend as much time chasing down the issues when people are calling to tell us about them and asking how they can fix them. And that we have processes in place that are keeping operators engaged, that we're confident they're going to get fixed when they've been identified and we've worked with those people. So the effectiveness has definitely been increased, and we're seeing the efficiency in that any one facility is not taking as much staff time to be successful, you know, as far from a food safety standpoint as it once did. And we're just seeing more of our restaurants understand and buy into that food safety culture that we're trying. Any questions?
And if I may add, Sean and Melissa don't just sit next to each other in these meetings. They also work very closely when it comes to foodborne outbreaks. The medical team working on histories, making certain people are healthy, making certain any information that's shared medically that has to be reviewed, that's done. And we work very hard at systems approach where the teams work collaboratively when this happens so that it's not one department's responsibility. It's the health district's responsibility in outbreak to maintain the safety and welfare of the community. So that's something we've worked very hard on. It isn't evident unless it's explained. So thank you.
And one of the things we have, the National Environmental Health Association is putting on.
Yeah,
Have you ready? Yeah, in early April, we're gonna have a National Environmental Health Association who's putting on a conference here at the health district. And any of our environmental health staff that have never taken it and our nurses who have not taken it, taking it, it's called the Happy Ready Foodborne Illness Outbreak Response. And so it's just teaching the staff how to investigate foodborne illnesses on a larger scale and how to identify the actual item that potentially made an individual sick, and then the whole response and how to report that to the state and to the CDC. So that kind of continuing course can be happening next month.
Sean, we don't go into like the larger food processing entities in our community. That's outside of our jurisdiction, like canning operations, things like that.
Right, yeah, we're strictly retail.
Retail, okay.
Yeah.
Any other questions or comments? Thank you, Sean. And we will move on. Next on the agenda is our agency reports, starting first with our executive director under custody.
Thank you, Mayor Byers. Good morning to the board and good morning to our guests and those who are watching on television. We're grateful that you're here. We've had an executive session, so I'll try to go through. But I did want to touch on what we just discussed. This this investment that we made in food safety, investment in environmental health, is really about investing in the community. And as Ron said appropriately, we are not regulation forward, we're community forward. And that means that we service the community, and by extension, we're servicing the people in our community by helping food establishments maintain high standards. And we found that it's not only in our best interest, but in the best interest of our community. We are an agricultural community where hard work is expected. I think in the restaurant business, people are attracted to that because they like service, not because it's an easy gig. And it's also the American dream. People start out with something small, and if they're fortunate, they're able to care for their families. And so one of the things we do from an equity standpoint is that we commit that any food establishment that needs our help, whether it's a national chain or a beloved local institution or someone starting out fresh, everyone's treated the same, which has really helped us and maintains the integrity of why we do our job. And that's really important to us here because it's important that we're available. It's important that government is approachable. And that's why we invest so heavily in, again, this idea of an open door concept, which is really a large investment. And I want to thank the board for their understanding that to be the kind of place that people feel welcomed and to feel the kind of place where people can learn takes investment. And so, you know, we used to not be open during the lunch hour, and now we are. That's just a simple change. It was actually quite complicated, but that means you have to have staff available at all times. And so we're really grateful the board has maintained their support for us being really focused on. I did want to also give some compliments to our national chains. We have many national chains here. And the reality is that they have very high standards. There's a reputation in that. So when you have a problem, it can affect your bottom line financially and also the reputation of whether people want to eat at your establishment. So we're also business forward in that respect. I just wanted to share that the environmental health program is not a regulation program in my estimation. It's a community investment program. I wanted to touch briefly on the fact that, as we discussed last board meeting, there has been changes to the leadership at the State Board of Health. We have an open position for the Secretary of Health. There's an interim secretary, Jessica Todorovich. We've now opened the job application for the Secretary of Health. That will continue on for a number of months, and my estimation is that we won't have a permanent Secretary of Health until May of this year. I just wanted to share that's an ongoing process. We are getting support from the State Department of Health, but the state is in a great deal of change right now in terms of potential staff layoffs and reductions in budget. So again, we don't have any definitive information for you. I know that can be a little vexing. It certainly is for us, but we are in the process of continuing our conversations, and we are being very forward with the state if there's something that we require to ensure that we're providing services on behalf of the community. At the same time, we're getting less information from the federal government about health trends. So we are, again, being very forward here to do research to make sure that we have the information. Certainly, Dr. Barr, Dr. Atterbury, and Melissa have been very supportive of us in terms of doing the legwork to find out what we need to do to stay safe in our communities. I also wanted to share that we have a lot of things happening in our community that I think are very pressing. And so I wanted to elaborate on what we discussed about the LA fires. That was a tragedy, a loss of life, a tremendous loss of infrastructure, people's homes. It's incomprehensible how painful that must be for that community. We went through a difficult fire season, last fire season. We were very, very fortunate that the majority of fires happen in areas that were not heavily residential and that they were able to be contained. It took a long time, and it was very dramatic to see the ridge lines on fire, but we did fare well. We are going to take very seriously this fire season and also the recognition that we are going to be hosting a fan zone. Am I saying correctly? A fan zone for the FIFA World Cup. We will be attracting people a year from June. Many people to our community who love football, American soccer, who love this community and are going to spend time here, but it is right in the middle of fire season. And we did not have an easy time with the public safety power shutoffs. It wasn't just fire. It wasn't just the potential threat of fire and the investment that our public servants were making on behalf of our community. It was the very real reality that people were anticipating the fire, shutting them off, and that affected our food establishments dramatically. We'll have more people here a year from now being served by those establishments, staying in our hotels, spending money in our community. We want to make sure they're safe, well supported, but also we have to share the integrity of the process of feeding them and caring for them and making sure they don't get sick. So we're taking that seriously now. We have the benefit of anticipating this. You will hear in the coming months how much time we're going to invest in that because we have a responsibility. If you have questions or anything you'd like to share, but we're at. Okay.
All right. Thank you, Mr. Prescott. Next is our Chief Operating Officer, Ryan Ibach.
All right, we continue to move forward with our building remodel project. We started advertising yesterday for sealed bids from contractors. And so that process will go through April 4th, where we'll open up the sealed bids to public. And then after that, we will work with our architect to move forward with a contractor that's chosen and get a contract with that contractor. But next Thursday, March 6th, our architect will be here to give tours to the contractors to tour the building and to see the scope of the project. So hopefully then sometime in April, we'll actually start the building process because we've been in the design phase for a long time. As far as emergency preparedness and response goes, the health district, our local emergency response coordinator and our public information officer participated in the Columbia generating station tabletop exercise. So that's in case of an event at Hanford, radiation event that will be prepared for. Also, the health district participated in the first session of the 5-year homeless housing strategic plan. And then also we continue, as Andre mentioned, to participate in the FIFA World Cup preparations or any emergency management type situation. So our food team will be involved in that too, as we expect increased food vendors for those events. That's all I have.
Thank you, Mr. Ibach. Any questions? Then we'll move on. Next is our financial report from James Porter.
Good morning. The financial report in the Board of Health packet starts on page 7, or you can just follow along on the. So we're reviewing the month of January. So I'd like to say for the first quarter, our BVA, our budget versus actual, is always very volatile. UCEH, there's a lot of work to be done, but there's not a lot of revenue as far as on-site or even food inspectors. People don't necessarily like opening up food restaurants in January, but we all like to go out to eat in January. So we're still doing the work, but the revenue isn't necessarily matching up with the expense. So for the month of January, we had approximately a $43,000 gain in excess revenue, which was a bit of a surprise for me. I was actually expecting a loss. We'll get into it. Our allocated budget for revenue is $13.4 million, and for expenditures is just under $15.7 million. For the month of January, our allocated revenue budget was 1.1 million. Our actuals coming in closer to 1 million, and for expenditures, it's 1.3 allocated budget. And our actual expenditures for January is $979,000. Any questions on the summary? And again, I will move along fairly quickly, just for the sake of time. If there's any questions, please stop and ask. Moving into the income statement, again, we're going to see some volatility, some fluctuations. First of all, with the Foundational Public Health, a bit of a difference this year. We received all of that funding up front. They generally chunk it up. $1.9 million every 6 months, more or less, but this time they give us the full amount in 2024. So that's going to create a bit of a timing difference that we're going to see all year long. The surprise to me this month was the investment income. We had a $306,000 gain. Part of that has to do with an adjustment for December. At the end of the year, the auditor's office goes back and calculates what our investment would have been if we would have completely liquidated at the end of December. That resulted in a downward adjustment for our investment income for 2024 of approximately $260,000. This is the resulting reversal of that. So our actual gain in investment income for January was 45,000, but because of that year-end adjustment, we're showing 306. That's it. Getting into a bit of the weeds, I wanted to explain that a little bit. If you have any other questions with that, please reach out to me. I would be happy to explain that. Moving down into expenditures, the enhanced program, the capital expenditures is for our building. So those will be large variances as we start to get into our building remodel, which we're expecting to start hopefully this summer. See some real movement with that. That is all, unless there's any specific questions that I'm going to speak through. Moving on to the next page. Again, what I would like to point out is here at the bottom, the FPH 2024 funding, we are carrying over $2 million from last year. So that's money that we're going to be spending up through the end of June. So that is gonna tick down. And a part of that is we don't have December completely closed. We should be closing December here in the next few weeks. But we don't have that number finalized. I don't expect it changing much from this $2 million, but it might slightly change.
I do have a question. I don't know if it's for you, Chase, or maybe to you, Andre. I will admit that I haven't been watching the proposed budgets for Department of Health. Do you have a sense for where the budget proposal will be for public health dollars compared to obviously the huge increases we just recently saw in the last 2 years? Are they going to be reduced?
Well, I think that's a very well-timed question. Did you want to hit some of it, Chase, and I can follow up?
If you want to talk about it after you complete the.
Yeah, well, we can get into it now if that's okay. There is a lot of uncertainty right now. Honestly, nobody really knows. I mean, maybe Andre can explain a little bit more. There is a lot of uncertainty with the federal funding right now. The state expectation is to remain the same. So foundational public health being our major source of funding. At this moment in time, they're not talking about cutting it. It doesn't mean in the future they might, but at this moment, our state funding is remaining the same. Increases, no, we're not necessarily expecting any increase for that. And so I think it's almost a wait and see with federal dollars. We do have some federal grants coming through that are for our breast cancer health program, our SNAP Ed program, and a few other minor for STIs. But those are the majority of those. Is there?
Well, Ryan, Chase, and I have been meeting regularly to be strategic about the fact that the state receives money from the federal government, which they call state funds, but is federally supported. There are federal pass-through dollars that we receive, like public health preparedness dollars. So we're anticipating that there will be reductions. So that's why we want to remain nimble financially, and why we've been so cautious financially, because we want to have assets. We anticipate that the reductions we just don't know when.
Maybe not for this meeting, but it would be interesting to know how much of our budget is reliant upon those pass-through federal dollars and then direct federal dollars. Because it seems like I don't expect to see a different change of heart in our current leader in Governor Ferguson with regard to some stances that might get federal funding cut off for the state of Washington and other states with similar laws on the books. So I do think it's important that we at least acknowledge what we may be having to deal with if federal funding does indeed get cut off.
Yeah, all we receive is indirect federal funding, so we don't have any direct federal grants. It's all indirect, mostly through DOH. We have one with HCA. And so yes, the expectation is there will probably be reducing as our federal funding for this year. We were expecting $1.8 million in federal funding. And so, yes, that is
big chunk.
Yeah. Yeah.
I would also share that in previous years, when there were reductions in federal programs, there were increases in state investments in the there were dramatic reductions in federal dollars, but it was made whole by the state. That's not possible.
That won't be this year because they're facing, a $6.5 billion deficit. I think they're going to have a very hard time trying to pass any of their tax increase legislation, considering the temperament of the public right now and how successful the initiative process has been. So I think they find themselves in a unique situation in which they are wholly dependent on the federal government.
Well, Commissioner McKinney, you are really perceptive about the fact that there are going to be changes specifically for the state. And also people are not comfortable speaking about what those changes are yet. That has to do with a new administration.
I'm comfortable.
Oh, yes, at the local level. Yes, thank you. Well, we have elevated these conversations, but again, we have a new governor. We had an existing governor for a number of years, which is really unprecedented. And we also
That's
had
one way to describe it.
Secretary of Health. We had for many years really consistency in those positions. So having those major changes, governor's change, the presidential administration change, and the Secretary of Health change has really reduced the communication around what next is happening. So, but again, we as a jurisdiction, as a health district, are well positioned with the support of the board. We've made cautious choices financially, so that's been to our benefit. But I do want to share candidly that there may be a need for us to re-examine how we invest in the future if we want to change our ability to be. Because I think it's going to be a very austere financial environment in the coming years. I will share with you that many of our colleagues around the state are absolutely concerned because they are in a fiscal crisis, and many of them have relied dramatically on local investments to make whole. And so we're again in a very good position, but it is a time of caution. So we will absolutely share this information when we get it. And if it's between when we meet as a board and there's a dramatic change, we'll communicate that out to you.
It's very nice to have a $6 billion surplus versus a deficit. And yet our state legislature managed to have those two things back to back.
Hard to explain that one.
I don't think so.
Moving, unless there's any other questions on the income statement?
Just, I know we've spent a lot of time talking about the remodel for the health district. I mean, with some of this uncertainty, we still want to move forward with the remodel, or is that something we want to put back on the shelf and wait another year?
Well, I mean, I could, sure. Well, first off, we have worked really well with the architect. We've really trimmed the fat, if you will, from anything. There were original budgets that were far higher, and we wanted to make sure that we maintain the integrity of the renovation. But we have benefited really from cost cutting. So even something as simple as when we do the staged construction in the building has dramatically reduced the cost. Changes to the materials dramatically reduce the cost. So this is not a retirement home renovation. This is a thoughtful one. Also, we have money already budgeted in our project. We have additional FPHS money that we're asking for that should benefit us. We've been very, I think, smart and strategic in terms of investing those dollars. We also, with the board's support, had asked for enhanced funds for the potential for investment, matching dollars, if you will, for the Emergency Operations Center. That's still in our budget. My understanding from our colleagues in emergency management here locally have shared that the grant that they were hoping to receive is not going to happen. So we had placed upwards of between $350,000 and $500,000 towards that. So that's still in our adopted budget. So I think we're in a good place. Also, part of the reason for the renovation is service to the community, improved efficiency in the building, and frankly, long overdue changes to the building, which will allow for an improved safety environment. So I'm not uncomfortable with that. We can certainly revisit that, but our budget's strong. Chase, do you want to just talk about that for the coming year?
Yeah, as far as now, we do have a strong budget. FPHS, as far as we know, is going to continue to move forward. We have quite a bit of banked revenue as well. It's one of those things. It's never a good time to really do it. Kind of like an ERP cutover. It's just there's never really a good time to do it. We have the funding now. Is really a lot of the driver behind that.
What could the funding be used for if it wasn't used for the remodel? What would be eligible?
Well, I mean, we could use FPHS dollars for a number of things, but we also have fully funded essentially those projects. So if we didn't do the remodel as an example now, we would lose the opportunity of investing state funds that were given to us by the state legislature for this remodel. That would not be something we use it for. We could find other reasons to use it, but we're well positioned through June 30 now And that's one of the reasons why we wanted to move forward quickly with the remodel, was to catch the right time for contractors with the fall and spring coming, but also we can invest these dollars in that project.
Well, I guess what I'm saying is, what's the flexibility? Because I'm thinking, you're looking at our overall budget, you lose $1.8 million in federal funding, and all of a sudden you have a remodel going on, and those funds could have been used to backfill some of that federal funding that might not be coming in, so that we don't see a diminishment of services that are provided to the community. So
So for that 1.8 million, there is no outside restrictions on that. They're not reserved for some other specific activity.
Yeah.
so there's major flexibility with those funds.
Yes, and also I did want to be candid. We had wanted the state legislature and the State Department of Health to support us, that the funding we receive would be within the calendar year like we would like, and that doesn't happen. So as an example, some of these funds that we're anticipating using for this remodel, again, will sunset on June 30th. So if it would be better timed if this money would end December 31st, but it doesn't. So that's one of the reasons why we were interested.
Yes, I'm sorry about that. So part of the funding that we are planning on using for this, if we don't use it, we have to send it back. to the state.
Sure, that's not always a bad thing. So the legislative session ends at the end of April. So I would just say that it might be prudent to at least see what happens by the end of the legislative session, to see if there is that same commitment. And then I anticipate that states such as Washington are going to continue to find clarity on their funding from the federal government, dependent upon their actions or inactions, to come into compliance with certain executive orders.
Oh, I'm sorry, Doctor.
I would just add that timing wise, from a patient flow standpoint, the remodel does allow for better care for our tuberculosis population. There's a tuberculosis outbreak in our area currently, and therefore remodeling now makes a lot more sense in the middle of an outbreak than it would, say, if we weren't in an outbreak right now. And I think we're finally, it seems that we're getting the edges around trying to contain that outbreak. And so I think that the timing now for the remodel makes a lot of sense from a public health and safety standpoint.
What I'd like to do, if the board is supportive of it, is to see the possibilities working with the architect, if we can continue to move forward with our original plan, with the idea that we, if the board is interested in us waiting because of the fiscal concerns, it doesn't imperil our ability to move forward if things are good. Because if we stop now, we don't begin that process, then we lose the timing. I think you also lose the potential for contractors who are interested in building in the spring. You lose your timing around foundational public health services dollars. I would hate, for as an example, to lose a couple of months and lose the opportunity for $200,000, $300,000, $400,000 of investment that, again, we've budgeted well, so we don't necessarily have something that's sitting out there that we have to use. I should also share that this foundational public health services has to be used by a public health system. It can't be something that we give to a community or do in the community without the express involvement of the state, or rather the local health jurisdiction. But I'm happy to do that if I think that.
Well, some feedback that we've received from our architect too is that contractors are slow right now. So they're actually coming to our architect asking for what projects are coming up. And so hopefully that will be reflected in the bid as well.
But again, we can see the flexibility that we have, speak to the architect, and then if it's to the board's comfort, we can share an email with you with an update. But I am concerned to stop the process. I think that what our architect has said, and thank you, Ryan, for bringing that up, is this is really an ideal time to do this because there are many people who have not anticipated projects. And so there are more people hungry for a project like this. I will share candidly that this is not a huge renovation. So if you have a massive renovation that's more expensive for your company, you'll want to go with that one. So this is a good time for us. I don't want to lose the opportunity, but I think that we may have some flexibility, but I can't speak to the technicalities of when and how you do that big process. So we can talk to the architect.
Yeah, I think it's important. So we've started the bid process, and so it ends April 4th, and then at that time, see what the bids are, and then we can talk about how we want to move forward.
Yeah, I like the idea of just keeping the board in the loop. you're not gonna know much more until April 4th anyway, so
Right.
with the bids, and then April 30th isn't that far away. It's not like they're gonna break ground in those 2 weeks.
Sure. And if I may just, sorry, Chase, this is your readout, but I do, from a financial standpoint, if I'm understanding the board correctly, the concern is if there was a massive fiscal crisis that we see on the horizon, that we're prepared to pivot to make certain that we have appropriate funds.
Well, I think specifically the ceasing the federal funding.
We could, as citizens, petition our governor not to lose those federal funds.
I have done so. Anyone else is welcome too.
So, that's more than fair, and we'll begin that process. I will also share with you candidly that a lot of federal funding is extremely categorical. It is dictated, and so we don't have some flexibility with some of that funding. I will share with you also, our main focus is to maintain the integrity of services we provide here, but also we've invested a tremendous amount in a wonderful relationship with our staff, invested in their training. We want to be able to retain that. We don't want to make rash decisions for a situation that may be temporary. When I say temporary, it may feel like a long time, but a couple of years of difficulty. If we have a career employee that we could retain, that's important too. So I appreciate your awareness of the consequences that may be looming, and we can definitely give you an update. And
How about this? Would it be appropriate for the board to send a letter to the governor stating what is at stake for the loss of funding coming to our community, specifically to the health programs, and that we are very supportive of him working with the federal government to ensure that we do not see the federal funds stop?
no, I think that's certainly more than fair, and I would certainly support the board supporting the fact that we are dependent on services here and in a time of crisis.
I would also encourage as individuals to reach out to your congressmen and senators. As I can tell you, like Safe Yakima right now, we can see that there is over $500 billion in forecasted money, meaning they were already appropriated by Congress last year. And they are not sending out the NOFOs. Right now, we would have, between January and February, we would have seen upwards of 75 grants that have been posted for prevention work, drug-free communities being one of them. And right now, there's about 8 that are posted.
Having recently been to DC, will say that many of the representatives have not, even senators and congressmen, have not even opened their budget for congressional funding.
Yes, in fact, I ran into Commissioner McKinney when I was in DC.
They're in the hallway in Congress.
Oh, really?
Yeah, it was kind of funny, actually.
Happens everywhere.
Yeah, we try to be. Would you entertain as chair drafting a letter sharing the sentiments that have been shared here? Mainly that we're concerned about losing federal funds and that we encourage the governor to work as closely as possible with the federal administration to make sure that our federal funding related to health does not cease.
I'm happy to do that with a consensus of the board. Any objections or concerns about that?
I second the motion.
Okay, well, all those in favor, say aye.
Aye.
Any opposed? And we'll move forward.
And if I may, I'm remiss in not letting Chase finish, but I did want to share with me, Alicia, you brought up a really pivotal point. Thank you, because I had not thought about it. And that is that the impact of changes to federal funding will impact many organizations in our valley. And so it is imperative that governmental services remain strong so that we can provide support to our partners who may be losing funding, to those communities that we serve. We would like to act and serve as that bridge here at the health district. So that's an investment that we wish to make. We'll need your support on that, but I anticipate that there will be many changes to organizations that have for decades provided wonderful service to people, and it's going to be impacted. So we need to do this, and on behalf of our citizens, so that they can feel comfortable.
It's just circling back quickly to the renovation project. I think it makes sense when you talk about timing, you know, having these conversations now allows the opportunity to save some money there. That it makes sense to do that. And I agree with the places to keep us in the loop.
Thank you. Thank you for your patience, Chase.
Oh, no, thank you. No, I appreciate this conversation. I look forward to that letter. Yeah. Unless there's any more questions or comments on the income statement? Next page, please. We're moving into program specific. Again, our FPHS being this plate color and all the little T's. That represents a timing difference, and that has to do with the funding from 2024 being utilized today. So this will be, all of these programs will be at a loss throughout the year. As the funding we had for that is in last year's. That makes sense. Next page, please. And again, we do have, similar to what Alicia's saying, we are moving on from DOH grants to come through. A couple of those is for our, gosh, I lost it, for our, immunization activities, and we are expecting some of that funding to come through. It's not a lot. But we do use it for those immunization activities. Moving down to E8 section, which is the blue section. This is where we'll see the most volatility at the moment. A lot of that has to do with seasonal. It just being cold and the ground's frozen, so they're not able to do much. Next page, please. This is wrapping up our EH with, so we have some quarterly billing that is still outstanding. Questions regarding program? Seeing none, moving into the cash flow. This looks a little wonky, but as the year progresses, we'll start seeing more month over month. At the end of January, we have $17 million in banked revenue. And I do expect to see that amount tick down month over month. Unless there is any questions, that concludes my report.
Any questions, Mr. Porter?
What's the current FTE of the health district?
We're at 51 right now, 52?
We're at 53.
And is that fully staffed?
No, 55 is fully staffed, but we are interviewing. Actually, we have positions closing this weekend, and then we have one that we're probably not going to fill. We're holding off on that one.
Okay, and I assume given the current nature of the environment, we're gonna be very conscientious about
Yes.
hiring and.
Yeah, we've already discussed any openings. We'll discuss whether we're gonna film or not as they happen.
Yeah, certainly don't want to hire somebody just to let them go. We were very conservative during COVID time. A lot of people went out and hired and really ramped up their workforce. And then unfortunately, a
Like
few
the school
months ago.
districts?
Yeah, a few months ago, they had to really, we did not do that. We made sure that if we were hiring somebody that they could continue on, that this was going to be a long term. Of course, we don't know what the future holds all the time, so there is some uncertainty, but we're certainly looking at the future.
That's proven. And from a community, just a visualization from the community, if you're out there beefing up staff at a time like this.
Yeah,
Community's gonna question that.
Agreed.
I should mention also, we work very hard. We don't hire staff grant dependent. So we hire staff and we want them here, as Jason, we want them long term, but we don't say it's dependent on whether or not we get money. We don't want to do that. And so that's actually helped us retain staff during difficult times.
Any other questions or comments? Like, Mr. Porter, you will move on to disease control.
Morning. I'll start with the respiratory illnesses for RSV and COVID. They are stable nationwide as well as locally. However, for influenza, we're having a extremely high rate in Washington State right now. Some of the eastern side of the United States that started off, it tends to lead. They're starting to see a decrease, but we're still extremely high. We've had 9 influenza deaths for Yakima County reported this flu season. Our positivity rate for influenza is at 25% for the county, which is extremely high. You're only going to see more of like a 1% on that. And then also in our H5N1, it's kind of in the background, we're staying aware of it. There's nothing going on locally, any outbreaks, but there have been 70 human cases reported nationwide in this current H5N1 outbreak with 1 death reported. As Dr. Atterbury mentioned, we are in the middle of a TB outbreak. We currently have 11 active tuberculosis cases. Not all of them are part of this particular outbreak, but the Yakima Health District is actively managing 5 of those. 6 are being managed by the Indian Health Services. We're also working closely with the Yakima Tribal Health, the CDC, and the State Department of Health for our efforts to work with the.
Melissa, you mentioned the 9 deaths. What,
Influenza.
right, and so what would be a typical, how's that compare to a typical year of influenza, or season of
It
influenza?
really varies. A few years ago, we had 2, but I would say maybe 5, 6 is pretty average.
We've seen this in a particular population, like the elderly coming out of congregate living situations.
Most of our, or all of our flu deaths have had either elderly or underlying health conditions. We've not had any pediatric deaths here locally. They have statewide, but not. And then the next topic is measles that's happening throughout the country. There's currently an outbreak happening in Texas and New Mexico. Texas has 100 as of yesterday, the stock market, right? There was 124 cases of measles in Texas and 9 in New Mexico and 18 hospitalizations out of that. We typically see cases here and there pop up throughout the United States. Washington had a few cases in 2024. We don't currently have any in 2025. The majority of these measles cases are unvaccinated population. So just encourage individuals to stay up to date on their measles, mumps, and rubella vaccine. That's a 2-dose series. The first one is between 12 and 15 months, and then 4 to 6 years of age.
The children that they're seeing this happening.
I don't know the specifics on ages. They didn't specify that. Sometimes if you have small numbers, they don't tell you, yeah, there's a small numbers rule, so you don't get to know some of that.
Unvaccinated adults.
But that from the Texas Department of Health site, it just showed 124 cases. So I saw
I think the majority are under 18.
under 18.
They're pediatric.
That's right. We did, our epidemiologist did show us that. What percent was that?
80,
80%?
over 80 was in the pediatric age.
Over 80%?
It was in the pediatric age group, correct, yes.
0 to 18.
Correct.
And unless there's any questions, that's the end of my report.
Melissa, just really quick, we've talked about it in previous board meetings about how we have this like child death committee, review committee. It's just been on my mind recently, but like what comes out of that committee? Like, is there any tangible things that will come out of that committee that come to this board for consideration, or actions that we can take, or trends that you're seeing at that level? 'Cause I know it's a very close knit review, and it's very sensitive, and there's a lot of sensitivity in those discussions.
Well, one of the things, last year was our first year actually doing our child death review committee. One of the things that did come out of that was putting trigger locks and lock boxes in Yakima Neighborhood Health as our pilot project to offer, because it's part of the questionnaires that are asked for every well child check. You asked, do you have guns in the home? And then being able to offer it. So if someone says yes, being able to say, would you like a free trigger locker or lockbox safe, to be able to have something to give them. We've also worked with, suicides was one of the ones that we reviewed. We worked to get together information in the Lower Valley where there's just not a lot of resources for youth, and putting together pamphlets to be able to hand out. Those are some of the more tangible ones that we've actually been able to see full circle so far. There is also a lot of work that's happened with the, let me show you, might know the name of it. Handle with Care Project. Sorry, I'm not sure if you're familiar with that, but yeah, that's actually grown quite a bit, which is when you have a child that experienced some traumatic event that had fire, EMS, police, that just notifying the school so that the next day they know that something traumatic happened to this child last night. And to just be a little bit more aware of any abnormal behavior, or just to be a little bit more handled with care, right? So that's something that's actually branched out further than Yakima School District, and I think is almost in almost every school district in Yakima County now.
Melissa, along the suicidality, I know when I was in DC, Chief Boyle had reached out, they put together a mini committee because of the 2 suicides, so Yakima School District girl and then the young man from East Valley that died by suicide. And Sean had said already year to date, we had 5 juveniles die by violence. And that was as of 2 weeks ago. Of course, now we have the one in Sunnyside. Is there anything that the health district is looking any kind of campaigns, working with, the school districts, anything like that in terms of addressing those issues. I find that the schools have a difficult time navigating. They want to bury it under the rug. They don't even want to say the word suicide. And I think that's extremely detrimental, because of course, all the teachings, all the trainings say the absolute opposite, right? Like we need to talk about it. We need to rip the Band-Aid off. We need to make sure people know there's resources, there's help, et cetera, et cetera. So going along the lines with the Latinx, what they were talking about, like that, I think that contributes to the stigma and the shame.
Well, there's certainly, feel free to talk about all other sorts of subjects, so it would be fair to also talk about that, because that is also a mental health issue, much like they're trying to address without medical professionals in the mental health sphere. They're having teachers address mental health issues, which is not what they're there to do.
I would add that, I know out in the Highland District, which is where I live out in that district, a lot of our campaigns are peer led. You know, we have prevention groups that it's all peer led, but you go into the high school and they have their own campaigns all over the walls, which is really nice to see, which is led by a professional. So it'd be great to see a lot of these things in a lot of our districts, which I know that a lot of them are working on it. It's just, I don't know if it's the same kind of effort, but it would be great to see.
There was, if you know who Mark Green is, pastor of Heights Church, he is looking at bringing someone into town sometime in the spring to do something locally that could help us start a campaign in that.
Well, the real issue is getting parent engagement, because it should be a parent-led conversation. I know that my son's school recently, just actually 2 nights ago, had a forum for parents to come and learn about how to speak to their children about significant mental health concerns, including suicide in middle school. But it really needs to be something where we set an expectation that the parents are leading the conversation. And truly, you know, we are in a really interesting situation right now in our state, where last year, on a unanimous vote, our state legislature ensured and restored parental rights. And that was affirming that parents need to be the leaders in the conversation. And rather unfortunately, right now, the state legislature is looking to repeal those and actually take away the rights that they just voted unanimously to give to parents last year. This is absolutely the wrong path. And I think that anyone in the medical profession and the mental health profession should be reaching out to our state legislators and saying, not having the parents be the priority and not having notification to children immediately when there's medical care being provided or medical advice being provided and referring them off campus, the parents must be notified right away so they can get involved. And quite frankly, the state is not doing a good job, because the child welfare and foster care system has nearly $2.5 billion in lawsuits right now that have yet to be settled, but have been categorized as needing to be settled and should equate to that much. When we are facing deficits and a lack of federal funding, you know, our children are at stake here. So this legislation has to stop, and it really should, there should be an outcry from people in the medical community and the mental health community to say, do not take away the notification of parents when teachers acknowledge that something's wrong with your child. We're going to do something about it, but you need to be notified so you can decide what that means.
And I think how the health district can navigate that without, I agree with Commissioner McKinney that yes, it is the parents, but the science actually says that as well. So we can navigate and say the number one protective factor, and this is fact, the science totally supports this, is parents and caregivers. That is the number one protective factor for all of our youth. And so encouraging campaigns of, like the Talk They Hear You campaign that you guys did last year. We currently have ours running again. It's our 4th year doing it. Basically saying, hey, parents, you are the number one protective factor with your child. Talk to them about all these different subject matters. Talk to Hear You leans more towards substance use, but why are they using the substances? Because they're coping with mental health, and they do not have resiliency skills developed. So their coping mechanism is, I'm going to try this medication because I need this short-term relief. And so I think promoting those as a health district and encouraging school districts, whether it's a meeting with superintendents and principals, to say, we can't bury the word suicide under the rug. Literally, when they reached out to Safe Yakima and said, we had a student recently pass away. Could you give us resources, you know, to share with parents and youth? And it was like, well, what do you mean pass away? Like, and well, we need to give them grieving resources. Well, how did this happen? What happened? And they like danced around it. And so literally we had to say, did they die by suicide? Well, yes, but we don't want to promote that. And it just was astonishing to me.
Well, you're actually, I'm grateful that you brought up the topic. I hear you. We're trying to reach out to start the conversation to support families having those discussions. I think it's very clear, and as a parent myself, there's a tremendous amount of in the growth and maturation of a child from birth till 13, 14. We do a tremendous amount. I think that the more a child is independent, especially if you're in a home where you have other children and you're raising those children, you may be working multiple jobs. You may not have the easiest time. It is deceptively simple to think that that child doesn't need you as much. They actually need you in some ways more. But that is not something that we feel we can just say, hey, you need to do more as a parent. The point about resources, the point about support, the point about finding ways to engage those conversations, and frankly, in culturally appropriate, culturally sensitive, in different languages. We are fortunate to be a very diverse community, but we have to invest, and I think that that's part of the responsibility of Health District is to find the resources to provide to school systems, to our partners, so that it's not government telling you how to do this. It's a whole community effort, and I am very grateful that we're having this conversation. I think it's something that's absolutely necessary. We don't want the loss of a child due to their own hands, but I'll also share candidly that it is not enough to prevent that suicide. There are many, many children who are in extreme situations, who are in crisis. Those children don't grow up to be the most well-equipped adults who then are not equipped to manage being an adult and being on your own. So this is a long-term generational commitment, and I think it's time to start now. And we'll likely get into it more in the coming months.
I will tell you that in the years I worked with families in crisis, one of the intervention pieces was teaching parents how to be in that kind of communication with each other. And those were families, 15 years ago that were in crisis. And that kind of general information was not going out to parents that maybe they don't have that kind of crisis, but are not equipped. There's been, I agree with you, there's been generational gaps in terms of parent-child relationships and development issues. And all of that has to do with physical health, mental health. It isn't just let's educate the parents. It's we as a community across the board have to be able to address the issue within our community. So whether it comes through public health, whether it comes through schools, whether it comes through parent education, all of those avenues have to work in the same direction.
I would just add that suicide happens in isolation. We have to find ways to not isolate people, to not make them feel separated, distinct, to include them in groups, social groups, peer groups, parent groups, church groups. I can say that. People that are engaged in their community are less likely to commit suicide. People that are engaged with their peers are less likely to commit suicide. Suicide is the ultimate isolation event where you end it thinking I'm alone and there's nothing I can do about it. So anything that we can do to engage our children to be part of groups, I think is important.
Well, and
Yeah, making sure people know of mentoring options. So like SAFE has a great mentoring program. There's other organizations in our community that same concept. So having at least a healthy adult in your life to some extent, and
Because they have some parents that are.
yeah.
I think that's a really great point. We also reviewed not just suicide, but the last review that we did, we looked at homicides. And one of those is, one of the barriers that risk factors that we found was that some of these kids, they don't have parents at home, and not because the parents don't want to be involved, it's because they're working 2 jobs to support a life for these kids. And in the same time, it's having a negative impact because they don't have the parental supervision. So they're going out, they're getting involved in gangs, they're getting into drugs, they're getting into, things that are not supportive activities or mentorships. And so we had a place here, I can't think of the name of it, but it's out of Tri-Cities. But it's a program that helps bridge so people who can't afford for their child to be in a sporting activity, they help cover that cost so that that doesn't become a barrier for a kid to be involved in youth activities. So, I mean, there's a lot of.
And we're always looking for more mentors.
Well,
We have one right here.
I'm sorry.
I just want to keep my viewpoint. All the suggestions or the comments that I heard, they're so similar. We can give out so many help out there. That as a baby, I came to Yakima in 1992. And by 95, I was working at McDonald's at age 13. I was cleaning tables. And if I was not working at McDonald's, I mean, there was no time to get bored. I was picking up cherries, picking up apples. I started working at Fortune Fruit when I was 15. Well, actually, I was going to turn 15. You would, they would allow you to work. You would get a parent's permission at the office. Your dad, your mom had to sign it, and you would go to work. So if mom and dad was not home, and you were 13, and you would make, like, I remember my first paycheck, I was making $5.15 an hour. My first check was $100. I was like crazy. And you know, as a 13-year-old having your own money and managing your own money, I mean, you had something to do. I mean, you had no time for going to games or being sitting at home playing games or watching Netflix. We didn't have none of that. So I think I don't know what year, if I recall, what 2000 when they changed like from young kids not to work. They changed it to what, 16?
It's still very difficult even.
Yeah.
Yeah, and it's still really difficult to get a
Limited
teenager. So
limited hours.
you have a teenager sitting at home doing nothing. They don't even take out the garbage. They're just lazy on their phones, on their TVs. And some of them are out on gangsters because, you know, parents are at work. They're not even doing nothing. But as growing up, for me, that helped me a lot. It helped me manage my money. It helped me set out goals. It helped me interfere with more people and learn more. It's just sitting home. So I thought that changing that law for kids to not work at the age of 13, it kind of make it really difficult for teenagers to
Yeah, it's an
Well, our
interesting
teenagers
point
are
that
like-
you're bringing up because our state legislature won't allow a 13-year-old to work, but they can make medical decisions for themselves.
Exactly, that's crazy,
for the rest
yes.
of their life. So yes, everything that the government tries to regulate turns to, you know, and we are seeing the results of it. So again, it is time to recognize that young children are still very young. My 12-year-old still sleeps with a stuffed animal, okay? So it is time to recognize that if they can't actually get a job, they can't be tried as an adult for a crime, they should not be making decisions that are going to impact their life, including harmful, horrible, irreversible medical decisions.
Exactly.
And these are all things that one can contact your representative about and constantly remind them of some of the issues and barriers.
Well, more importantly, I appreciate that, Lupita, it's important to contact legislators who live over in the west side of the state. Because not all legislators are supportive of the types of actions that are occurring in our state legislature. And unfortunately, there is a strong majority who reside in major metropolitan areas. And they are either unaware or ignorant willingly of the reality of their poor legislation. And after decades and decades, our children are less healthy, both physically and mentally. We have an absolute crisis on our hands, and they want to remove the parents even more and turn them over to a government system that continues to fail them.
Thank you, Commissioner.
Yeah, I just want to appreciate the comments about work. I very much value the opportunity to work. I started milking cows when I was 13 and I don't think it hurt me. It's good to be able to work. The other thing I do want to mention is that, you know, we need to teach our kids to work. We want to teach them to read. We also want to teach them to pray. We need to turn our kids and our families to God as well.
We had someone else who wanted to make a comment. Go ahead, please.
I just want to say something really quickly. Sorry, I bring my kids, but I want to be here. So we work as a community leaders, directly working with the people, just directly talking with the real people with real problems. So if you decide with the funding go, I would suggest you just go with the organization that work directly with the people, because so many money just waste into the middle level, never go down. So we talk with people, with mothers who have devastation because they struggle with money or with so many issues in their head. We talk with with parents that are working so hard, and even though the money is hard to provide with their family. So because we talk to them, we need to be prepared too, to tell them the right things to help them to go to this process. So that is my point, that there are so many money in organizations that you say that help people, but in the reality, they don't even know what is happening. They just think about it, but the structure, they haven't even talk with the real people with real needs. So many people that are sitting right here, we talk with them. We know what is Yakima, value Yakima problem. So that is my point. Like just check where are the results of the organization that has the money, because it's just wasting money.
I will agree with you because government pours a vacuum and so it fills it with bureaucratic people making that money. But, well, I'm sorry. We need to move on, but if you'd like to make a comment, please go ahead.
Yeah, just real quick, I wanted to say that I had somewhat not directly affecting me, but just to talk about suicide and also the handling it on the west side. I used to go to Bellevue School District. In my middle school, a 7th grader committed suicide at the school. They found him in the bathroom. And in high school, another girl committed suicide when I was in 9th grade there. So it speaks to me personally. And mental health awareness is such a big thing over there, but how much is it actually like affecting positive change or preventing these things? So I think that's also something we can't just like throw out like mental health, positivity and all this stuff and expect it to, prevent things. I think it's just, I personally don't like have strategies or any thoughts about that, but I think it's just important to acknowledge that as well. And it, spoke to me because I have a somewhat of a personal experience with that kind of thing.
If I may, hold on.
That's okay. I think at this point, we're going to end the discussion. We need to move forward with the business of the day, but thank you everyone for contributing your thoughts and ideas. Who was speaking last? I think it was Mr. Porter.
I'm all done. Thank you.
What do you got, Melissa?
I'm all done.
If there's no questions from Melissa, we'll move on to our public health partnerships. Lillian Bravo is not here today, so.
You want to do Sean?
We already talked.
You talked a lot.
I'll keep it brief this time around. So, in regards to, PFAS and groundwater near the DTG landfill, we were successful in getting the, area around DTG added to our alternative drinking water funding. So, outreach is being done currently to households around, DTG, and I believe we have at least 5 people enrolled for, certified lab testing for PFAS, and if there's detections, filtration, point of use filtration will be offered, but this is even bigger than that. This is big in, helping us identify is that release that's been detected going beyond the footprint of the landfill, which will tell us a lot. So we'll have more information on that here in the next few weeks. In addition, next month, you'll probably see a proposed ordinance for our on-site sewage program. There was a revision to the administrative code. So we typically write an ordinance to adopt that code as a statute. So our activities are vetted and, we can enforce upon that when we need to, or rely on that as how we do that, carry out our business and on-site sewage locally. So that'll be sent out for all of your review by the next meeting. Another big one is our Acela, our permit management software that we share with Yakima County Public Services. We're migrating from on-premises to the cloud. That migration is happening beginning in the afternoon of Wednesday, March 26th. And we will be without a cell. It will be offline until April 1st. So that means our services will be limited. We'll still be open and we'll still be serving people. We just won't be able to look up records or print licenses and permits, those sorts of things. So we're working on, we're getting email lists from all of our permit holders, all our stakeholders, event organizers, things like that, to send out some messaging, letting people know that if you need something between the 26th and April 1st, come in before the 26th. We'll be limited for a little bit of time there. So
Sean, will Lillian's team be putting something on the website as well?
yeah, we're working with Lillian's team. So there'll be a lot of communication being put out there for people to see. So I believe we'll have signs up in the lobby.
Yeah, we're also doing this in conjunction with the Yakima County Public Services. Yeah.
And suggestion, because the dashboards for the federal grants, we were trying to do our draws and we kept getting error messages and error messages and error messages. And so we called the help desk and they said, well, we updated it on the landing page. Well, if I can't log in, I can't see the landing page. So I was like, you might want to put it on the page where we're actually trying to log in. So just something to think about.
Well, we will continue our help desk, but again, people will probably be frustrated with that. That's why we're trying to get it out there.
Yeah, we'll do everything we can to make it as easy as possible on our clients. So that's all I have.
Sean, the on-site sewage ordinance that the board's gonna eventually see, are they just minor tweaks that won't really impact our community, or is this big stuff that we should expect community members to be?
The ordinance itself will be very, very similar to the solid waste ordinance, which adopted the RCWs and WACs. The WAC revision is pretty robust. So the operation and maintenance requirements for septic systems and the property transfer inspections of septic systems. And including lot sizing, minimum lot sizing requirements. And if you go below those requirements, you have to do nitrogen reducing technology for your septic system, things like that.
So it is a big change for us.
It's a big change for the entire state, for all locals, but yeah, typically when there's a WAC revision, we like to put forth the updated ordinance, simply adopting that. Because we can only be more stringent than the WAC, we can't be less.
Any other questions for Sean?
That's it.
Thank you.
Thank you.
Then I'll repeat myself that our Public Health Partnership, Lillian Bravo is not here today, and we will hear from Ryan Nybuck.
All right, Lillian did send me her report and there's 3 things that she'd like me to share with the board. The first one is the EPA grant. So Yakima Health District and Dr. Consuelo Rodriguez have finalized a well water safety curriculum for the community health workers. The community health workers will be trained to conduct home visits with private well users in the Lower Valley. The curriculum will cover groundwater basics, common well water contaminants, guidance on well inspections and testing, and information on water treatment options. The community health workers are currently undergoing the training, which is expected to be completed by the end of March, and then the program where the community health workers will be going out to the homes will launch in mid-April. Questions on that? Okay. The next item is parent-focused overdose prevention campaign. So this is a multimedia campaign that builds upon our previous efforts to encourage parent-teen conversations about drug use and overdose prevention. Phase 1 of the campaign will be the research phase, where we will hold focus groups together, valuable information from parents, caregivers, and community members who work with youth to inform the creative development. So the goals of this focus group is to better understand, 1, how parents and caregivers approach conversations about drug use prevention. Next is what challenges they face in discussing this topic with the teenagers, what resources or messages would be best supported and empower them, the role humor and relatable content can play in making these conversations more approachable, and then the findings will shape the campaign's message, creative direction, and outreach strategies to ensure it resonates with families in Yakima County. So we are planning on hosting 5 focus groups the week of February 24th, this week. So there's going to be an in-person one in Yakima, in-person one in Lower Valley, 2 virtual options, and 1 the Yakima Nation focus group. Questions on that? Okay, and then finally, there's the youth-focused substance use prevention campaign. So this campaign expands on the Escape to Escape initiatives, focusing on youth-driven messages to prevent substance use. We're partnering with Yakima Neighborhood Health Services, who are taking the lead on this campaign to ensure that prevention messaging is relevant and impactful for young people. Focus groups to gain key insights into how youth in Yakima County prefer to receive prevention messaging. And these discussions will help shape the campaign's messaging, create direction and outreach strategies to ensure that they resonate with the young people. So the goal of these focus groups are to, one, understand how youth prefer to engage with prevention messages, what communication style and platforms are most effective, what types of creative content such as art, media, and messaging resonate the most, and how the campaigns can better empower and involve youth in shaping its message. So 3 focus groups are planned in Yakima, Sunnyside, and Wapato.
So Ryan, it seems to me that Blue Pizza, your organization, already kind of, it seems a little bit of a reinventing the wheel. Because you have done such a good job with your community organizations to really talking to kids and understanding how they want to communicate. I wonder.
Oh, you mean the community coalition?
The coalitions have been doing that. So I just wonder if it makes sense to involve at least send an invitation to the community coalitions to participate, because I think that you could achieve something much faster. They've already been doing it for years. And similarly, I think Alicia, Yakima has a lot of engagement and information as well that would be able to talk about, and nothing against the neighborhood health, but I think there are other organizations who've already done this work that would probably help speed the conversation along to come to a desired outcome.
My concern is, are they doing something evidence-based? I'm not sure that neighborhood health is on the spectrum of prevention and using evidence-based strategies. So an example is the positive social norms that we're using the opioid settlement dollars for. So positive social norms is evidence-based, goes back to the 1980s. And it basically, there is a common misconception among adults and peers in the population about the percentage of youth that use substances. They overwhelmingly overestimate. They say 60, 70, 80%, when in reality, all substances, it's less than 10%. But you still don't focus on the negative behavior. You don't say only 10% of Yakima youth have used substances in the last 30 days. You flip the narrative and say the overwhelming majority are choosing not to use substances because we are all adults and youth alike. We're all creatures of social norms. But what we found when we did the pilot, so we were involved in the national pilot the first time they targeted middle school age, and the results were nothing short of astonishing. So much so that the pioneer, so when you hear like Montana Institute, all them, they learned from the guy we learned from, Wes Perkins. He ran it through his database 3 more times because the results were so astonishing. And the reason why is they found that at the middle school age is the age you start to establish to be influenced by peers. At elementary age, you still listen, you idolize the adults. You don't care if the adults are wearing Nike or what brands they're wearing, but starting that middle school age, 100% you're being influenced. And so we saw referrals at Wilson Middle School, for example, for substance-related issues went from 77 pre-campaign to 21 during the campaign. So the number of kids getting sent to the office for using substances. And we saw it across all 4 participating schools. We also saw 25% across the board, they were choosing healthier alternatives to cope with stress. So they were hanging out with friends, drawing, referring to music, et cetera, et cetera. And all substance use for 30-day use was down anywhere from 15 to 50%, depending on the substance. There is no other campaign in the country that has those results that fast. That was in a year, year over year. So to Commissioner McKinney's point, I just want to make sure that they're using whatever they do, that it's evidence-based.
And I would also add that the community coalitions have at least 10 different community sector representatives that are all back to the community. It's all grassroots. And there's quite a few of them in the community, including SAFE. So.
I think what we're just saying is that the concern, and this has come before the board, is that, well, it actually speaks to the young mother in the back, that It's a massive organization with lots of different programs. And does the information actually get into the hands of the people who need it? And I think the attempt here is definitely a noble one. How do we communicate to children? Best way to understand children is to ask their parents. But I think that the evidence base is something that we're relying heavily on the board. Because quite frankly, we're spending a lot of money and we're not getting the desired outcomes. And that is wholly because the programs that are being presented, well, typically they haven't had accountability, and the number one way to assure that you receive funding was to spend the previous funding. And we need to change that. So if the program is not having the desired outcome and the success rate the community expects for their money, then we need to move on to a different program. But yes, I really think the evidence base is the way to go, and that's what parents are hungry for.
Oh, I'm sorry.
Amanda, I would just add that I think that we're living in an environment where we're being programmed by social media algorithms. I'd love to see initiatives to where we look at the core causes of what is the basis of that programming? How is it affecting our youth and their decision-making and their peer groups? Why is it that we're being made to feel more and more isolated? Those things are all measurable. And I think you'll find that there's some nefarious actors out there that are manipulating the population into thinking they're in one group when in reality, they're in the majority. They just can't speak up. They're made afraid to speak up. So I just think that I would love to see this body and this health department start looking at how are we being programmed by social media algorithms and what can we do to fight that programming or to at least shed light on what's going on so that parents, children, everybody is aware that we are a product of our environment, but we're more of a product of our programming.
That programming is in the school hallways as well, and it's in the form of posters and promotions of things, and that is something that is being programmed into the program. That's got to stop.
I think just a level of awareness of how all of us are influenced by social media. And that has been a very directive force in our society. And so maybe our, part of our look should be, how do we prevent that? How do we get more effective, truthful,
Lock up the
evidence-based
phones in
information,
school.
right? Yeah, into, not only, it's happening with their children, because honestly, we as a generation have allowed that to happen to our children. We've allowed it to happen to ourselves in some ways. So we need to be educating ourselves as adults about that. And then beginning to educate our children as well.
But we have to stop treating children like they're adults. Because they're not. They actually need to be parented.
I was gonna share that, these programs came out of these kinds of fruitful conversations with the board about an interest in prevention around opioid overdoses. My understanding is that we have worked with and continue to want to work with the community coalition. So we're happy to convey that to Lillian. The other, though, is that this is part of what we refer to as the catalyst model, which is that we find the issue, we find the partners, we find the funding, and we find solutions. So it really is a community investment, but we're happy to talk to Lillian.
Any further comments or questions? Not from the audience at this point, thank you. From the board. All right, then we will move on to community programs with Gabby Alvarez.
Hi, everyone. Good morning. So I'm going to be giving an update on our developmental disabilities. So Daniel, our developmental disabilities transition coordinator, will be leading the first collaborative meeting with Developmental Disabilities Administration, DDA, DVR, Division of Vocational Rehabilitation, and the teachers from across the school districts in the Yakima County as part of our partnership with transition services. So moving forward, they will be having a meeting the last Wednesday of every month, just like us. And they will be collaborating and having conversations about the transition services that we are offering. So far, 10 teachers have confirmed 8 different school districts and 1 tribal teacher from the Yakima Nation Tribal School in Toppenish. And this is great news because for years now, we have been trying to reach the tribal schools, and kudos to Daniel. He actually got us a connection. So we'll be working closely with them now. And just for anyone that doesn't know what transition services are, They're for these young adults age 18 to 21 that have developmental disabilities, and we're preparing them for the workforce so that when they turn 21, they can get employment. So that's what our transitions are. And do you guys have any questions about that? Moving to our front desk, we have started preparation so that they can inform customers about us not providing environmental health services because the Acela will be down March 26th, 27th, and 28th. However, we are still providing other services such as birth and death certificates and food handler permits as they are not going through Acela. So we'll still be up and functioning with all these other services. That's pretty much it. You want to have any questions?
Questions for Gabby? All right, thank you. We will move on. So item 8, we have no unfinished business this month. We're grateful for that at this point. Item 9 is new business. Do you have any new business by members of the board this month?
I was just gonna share that this has been a really robust conversation about the perils that face our community and our concerns around supporting our families, certainly doing healthy. But I did want to share one of the things that is always encouraging to me about this community is the commitment to family and the commitment to caring for one another, even in tough times. And there's no lack of love in the valley. And I share that because that's one of the things that really encourages me that sometimes people have a tendency to look at the difficulties that we're having. And I'm sharing with you that there are so many assets that we have in a community engagement, the willingness of people to support each other, especially in tough times. It's been part of what many of us and so that's what we're really harnessed is working directly with community and social organizations to reach the people who I know love their families and love their children desperately. They're just sometimes facing barriers that they don't know how to navigate. Thank you.
And before we close, I would like, Edie, would you stand for one moment, please? So that our guests this morning will recognize who you are. Edie works with Comprehensive Health here in Yakima Valley, and I think would be a great reason to start some conversation with in terms of how you find services, increase services, what's available, how to connect with them. After. The other is that we've had a lot of conversation today that has had to do with frustrations in our community and ongoing problems that we don't seem to be able to turn around. I, for one, am in regular communication with our legislators. And so I would encourage you as individuals or as a group, because as a group, you have a strong voice as well, to be in contact with our state legislators, about what you'd like to see or not see happen in the state in terms of, what helps you, where your funding comes from, where it goes to. Those kinds of things that legislators have authority in the state, I think would be very helpful. So if you don't have access to that information, I think any one of us county commissioners or myself as Mayor of Yakima will be happy to provide you with email addresses and contact information for our legislators. Okay. Any other new business? Hearing none, I would entertain a motion to adjourn to the next Board of Health meeting, March 26, 2025.
Motion to adjourn.
Second. So we have motion and a second to adjourn to that meeting tonight. All those in favor, please say aye. Aye. Any opposed? Good, good, good.